Save the Children South Africa has expressed concern about the safety of children as a heavy flooding claims the lives of more than 300 people, including children in KwaZulu-Natal. And as we've just heard, flooding has halted education for thousands of children. Now, to discuss this, we are joined via Zoom by Save the Children South Africa's Director of Programs, Gugu Xaba. Gugu, thank you so much for your time this afternoon. The floods in KZN will no doubt go down as one of the worst natural disasters in the country, and children are unfortunately hardest hit. What are you hearing and seeing on the ground in this disaster?
Thank you very much to you and the people that are leading news. What we have seen, as it has been indicated, we have lost lives of parents, we have lost lives of children, and that immediately says children are destitute. Children do not have homes. And thus you have seen the government has set up community halls as places of shelter. Now this says we have children that do not have adults that are responsible for them. So this means children are exposed such that there could be some level of abuse, one way or the other. It could be because of predators, but also it could be because they are alone and nobody's taking care of them. So Save the Children is worried about the safety of the children that are destitute as we speak. Besides that, you have also indicated correctly that children may not be able to go to school. If over 250 schools are not opening, it means you have maybe 10 times that number of children that are going to suffer and not have education. So this main responsibility to assess what the needs of those children are, communicate with the schools to make sure that we can at least use digital learning for those children that are in shelters. But one thing we've seen is that some children are in homes of either relatives or people that were kind to take them in. That means we still have more children that are in different places besides the shelters that needs to be taken care of. And thus we are doing the assessment to check how many children are in need of education and how can Save the Children and other organizations help to provide the education. Then we also have health issues that are a serious problem. One, we have children that are injured maybe, or that are being exposed to the rain, as the children that we've seen right now, who are later on going to get flu. So we are calling upon health services to be available to take care of physical illnesses, besides the psychological illnesses that we know will start now and linger for quite a long time. So we're calling upon health services to provide physical health care and psychosocial support in order for us to be able to at least provide some type of services and support for the children and the adults that are going through the flood, the impact of the floods. And also, let's not forget that some adults are there with their children, but because of this displacement, it means adults are also psychologically affected. So there's need for psychological support for parents to be able to continue parents in this most difficult situation. So Save the Children is also looking at how can we help parents to be able to take care of the little that they have now, but still provide good health for their children, provide good support for their children. So those are some of the things that we're looking at. Yes, we know there's need for food, there's need for safe water supply. There's also need for ensuring that we can, as government, look at the infrastructure that is there and see how our families that are in KZN can be helped. So those are basically the things that Save the Children is looking at. Thank you.
Ma'am Gugu, we know that the Premier is going to be giving an address at 4 o'clock this afternoon. Supposedly it will start around about that time. We also know that there are, billions, or in fact millions of rands that have been donated as part of an emergency relief fund for those that have been affected by the flooding. And as you've correctly said, children are obviously at the heart of the displacement. 40,000 people have been displaced as we speak in KZN. What would you like to hear from the Premier this afternoon in as far as children are concerned, particularly if you have to look at the immediate needs of those children?
Okay, thank you very much for that question. What we'd like to hear from the Premier this afternoon is that, do we know the number of children that are involved? Save the Children and other organizations are available to provide the support in terms of assessing the needs of the children. Once we know the needs of the children, we'd like the Premier to also call upon businesses that are around KZN and outside KZN. That is why Save the Children is talking to businesses in South Africa and outside South Africa to say, what kind of support can you give us? If we need safe water tanks, who can contribute to paying for those safe water tanks, and let's get them to the people who need them. And of course, the food is available, but it's not enough given the situation. As you can see, the number of people that are destitute is growing on a day-to-day basis. So we're calling upon business, we're calling upon other philanthropists to contribute for us to be able to support the people that are in need. And we are calling upon health services to be supported, because at this time, we know there'll be shortage of staff, there'll be shortage of resources. So some of the resources must be brought for us to be able to give to the health department. Let's have the medication we need. Let's have the psychological support we need from social workers and from psychologists in order for us to take care of the situation. And that is what we would like to hear the Premier announcing about children. And education. I nearly forgot the most important thing. Education of children is important. As I said, we are going to be distributing tablets in order for some of the children to continue with their education. We know with COVID, we've lost so much learning. So we do not want to see that happening again. So we're calling upon the Premier to ask educationists to work together in order for us to support education of children. No matter what the situation, it's possible for them to learn. Early childhood development and basic education is suffering at this point. And that is what Save the Children is asking for. Thank you.
Now, the unfortunate part is that, over 50 hospitals have been severely damaged, 500 and so schools also severely damaged. You talk about, trying to see where you can help in as far as education is concerned, considering that come Tuesday, schools are going to be open and education will resume in those schools where it can actually resume. Talk to us about the worst districts that you are seeing have been affected. We've been reporting on several, including eThekwini, Ilembe and Ugu districts.
Okay. The district that Save the Children has had some level of assessment is eThekwini. And as you know, the most damage happened in eThekwini, including Ilembe and others. So those are the two most districts that we are requesting that we increase the support in. And as you are mentioning, if health services 50 facilities are struggling at this point, it means more people are going to be affected. It's the ones that are affected by the flood and the ones that were not affected. Instead, they need healthcare services. So it means the contributions that we may need to provide us with mobile health units so that we can be able to provide services at the point where our clients are at. And at eThekwini, I know about 25 community health centers have been identified to provide them with shelter. It means even the other districts, we need to identify more shelters and more mobile health units who will go into these shelters and other neighboring areas in order for us to be able to take care of the health needs of our people.
Ma'am Gugu, you are also calling on government of eThekwini to look into putting in place long-term solutions because, these floods are not new to the region. Talk to us about some of these solutions that you speak of from a long-term basis.
Thank you very much for that question. Look, it's been noted that some of the houses that are affected, even according to town planning, they are not located in an area that it is advisable to locate housing. So it means our municipalities and the town planners need to kind of be stronger in controlling areas where houses are being built, so that we need to educate communities about the value of listening to these town planners, because at times our communities maybe don't understand why they should not build houses in certain areas. I think that is one. From there, the infrastructure that is provided in terms of the reticulation system for water drainage where homes are built, it also needs to be beefed up. Yes, I know at some point, I think the Premier mentioned that those piping systems are not well taken or care of in our communities. It means KZN knows the areas that are mostly affected. So in eThekwini, for instance, there's need for regular checking of those systems so that we can keep those infrastructures in order. The other thing, there's a need for our communities to listen to when we have the Weather Bureau indicating some of the kind of rain that we are expecting. Let's listen so that we can be able to work with municipalities, one, in evacuating houses that need to be evacuated. So it means even our preventive section in terms of dealing with storms that may be coming also needs to be strengthened for us to be able to reduce the people that become destitute and the deaths that occur. And other infrastructure includes the housing system itself. And that is a bigger section that maybe the Department of Public Works need to come in to support us to make sure that we've got better housing structures for our families in order for us to protect their lives. Thank you.
Ma'am Gugu, as we wrap this conversation, there's something that you mentioned, right in the beginning of our discussion, and that is the well-being and the health of the children. Talking about psychological well-being, these children, I'm sure, wherever they are, particularly those that still don't have permanent structure, are severely scarred psychologically. What can be done from an immediate perspective, do you think, especially for those that are looking after some children who have lost their parents?
Okay. Thank you very much for that question. The first thing that can be done in the shelters where some of these children have been housed, it means we need to have social workers and psychologists who are assessing the level of strain that some of the children are going through, and providing the immediate support that can be provided. And of course, that means we need to start locating other relatives that are available that could help us in caregiving, because in many instances, children will trust the immediate relatives before they can trust any other person, either a foster parent or something. But let's start by locating people that are around that child so that they can be made available for the child to live with as the child trusts them. Then from there should be continuous psychotherapy so that the children, one, the trauma that they've seen, they must be able to understand what they're going through, because there's a lot of confusion on these children right now. And then there will also be post-traumatic disorders that we're going to be dealing with because of this situation. So the counseling must continue. And in our schools, there's need for us to continue. Let's say they have gone through the floods and are back in school. There's need for continuous therapy, because some of the reactions are going to be delayed and they will affect their learning. So there's need for such children to get long-term therapy, and their families must also get therapy. Plus, we also need to arm the children that are around these children, need to be able to support them one way or the other. One example could be just to have a listening ear for this particular child. Besides that, let's make sure that other needs are taken care of. Healthcare needs, food, and just shelter, so that at least there's some best thing that is happening for this child besides the psychological issues that they're dealing with. So there's need for good caregiving around the particular children. to start with, and then later on we can continue with other support. Thank you.
Ma'am Gugu Xaba, thank you so much for your time this afternoon. Really do appreciate it.
Thank you.